I think the most important thing I work out in my mind when I'm working up a patient for laser is I like to get a really good idea about their lifestyle and what they do for their occupation. So, what's their job and what are their hobbies and why do they want to get out of glasses? So, they're like my first questions usually for a patient, like why are they here and what's the like why they started this journey with us. And that gives you so much information. So for Smile Pro, I've had a lot of athletes, a lot of people like that do contact sports, mixed martial arts, things like that. Because of that small cut in the cornea, that small incision, there's not that whole area, that whole flap that can potentially be disturbed if you were to have trauma to the eye. Now, we're talking about very, very rare events. So the majority of people that have LASIK never have any problems. They have it till the day they die. Those flaps aren't touched and everything's fine. But there is a very small risk that if you're doing combat sports or mixed martial arts or things like that, and someone was to get a fingernail in the wrong place at the wrong time and it just nicked the edge of that flap and it lifted the flap, there is a very small chance of what we call flap dislocation or flap trauma. And it's just minimized completely, or basically it's completely avoided with Smile Pro because the little cut we make is under your eyelid. So the chances of that 2 millimeter incision being open is basically negligible, just doesn't happen. So if I have really keen athletes, or I've done quite a few mixed martial arts players, I've done a few rugby players now. So those kind of people, I usually lean towards Smile Pro. It also comes down to, as you said, when you assess the eye, many factors. So it's not just lifestyle, but that's one of the factors. But then you look at things like their prescription. So up until recently, you couldn't do hyperopic or long-sighted smile. So that was off the cards. So for anyone who was long-sighted, LASIK was a better option, or was the only option in terms of laser surgery. And also with Smile Pro, the prescription really does matter. So very, very small prescriptions. So say you're a -1, the little disc that I keep mentioning, that becomes too thin with really small scripts. And surgically, that becomes too challenging to remove. It's not really safe to remove. So for very low myopic or short-sighted scripts, we usually opt for LASIK as well. So it varies depending on the patient. We can do some things artificially with a laser to bump up the size of that disc. But on average, if you're around a -1.5 or lower, usually LASIK or PRK, which we haven't really chatted about today, but they're better options than your Smile Pro. And then we can also look at the health of the eye, so how dry the eye is. So for patients that have pre-existing dry eye, Smile Pro is generally also my recommended option. And that's, again, all comes down to that little cut in the cornea or that little incision. So with LASIK, when we create that flap, we are cutting through a lot more corneal nerves. So in the surface of the cornea, there's little nerves that, innervate the surface and they help with keeping the eye lubricated and the tear film nice and healthy. And with LASIK, because we're making that kind of can opener shape, we are cutting through more of those nerves. Whereas with Smile, it's only a 2 millimeter incision, so there's only very slight disruption. So we do find that dry eye is usually worse in the short term for LASIK. There's been large meta-analysis studies that have shown that 1 year the outcomes are very similar for the two. So we're talking more about in the immediate phase. But generally, I assess the dry eye, and if they do have more dry eye, I push them more towards Smile Pro because it's just going to be a nicer and quicker recovery, more stable refractions, and more comfortable for the patient. They might not need to be on so many eye drops post-operatively. So these are just many of the factors that go into our decision making for whether we determine whether a LASIK or a Smile Pro is a good option for the patient. And it's really nice to have multiple options. So we also have PRK. So we have 3 different options really for laser that we can offer patients. And it's actually, I use all 3 of them because every patient is individual. And you notice that every patient, you have to tailor the treatment for every specific patient. So there's no one rule fits everyone. And that's really nice that we have those options, and Smile Pro just adds to those options basically.
So you said that with Smile Pro now, you can also do something to help people who are hyperopic, meaning they
Hmm.
are long-sighted. They
Hmm.
struggle with up close, but they can see fine at a distance. And so that's kind of a, like a big advantage of Smile Pro for those people, would you say?
Yeah, look, I think it's much newer. So the hyperopic or the long-sighted Smile Pro is actually quite new. So I don't, unlike the myopics or the short-sighted Smile Pro that we've been talking about, where there's been 10 million cases, we don't have the same long-term data, but the initial results are really promising. And we already know we can get really good results for hyperopic or long-sighted patients with smile with LASIK, sorry. So I do quite a lot of patients who are long-sighted with LASIK,
Okay.
but there's only a certain range of prescription again that's suitable for laser. So that this is getting quite technical now. But when you come for your assessment, when the patient comes, we go through all of this with the patient and we work out if we think their script will work with Smile Pro or if it work for LASIK or whether we actually need to do a completely different option like inside the eye, so a lens-based option. So again, this is why our assessment takes quite a long time. So the initial laser assessment, it's an hour and a half. It's quite long. Patients are always quite shocked at how long it is, but it's really because as you can see, there's quite a lot of factors that go into the thought process behind it. It's not a 2-minute rush decision. It's actually quite complex. The hardest part of laser is actually the workup and work like the suitability and working out what's the best procedure for the patient. So yeah, I think there's lots of options now, but it has to be very individualized.
And before we move on, so I think we should maybe just mention again that people who suffer from presbyopia, which is,
Yeah,
that condition
yeah.
you get from too many anniversaries of your 40th birthday. So that is something that LASIK and Smile Pro doesn't or isn't intended to address. Is that right?
No, so as we chatted about last time, PRESBYOND is a type of LASIK procedure.
Okay.
So we're still doing LASIK, but it's a special type of LASIK procedure that combats not only presbyopia or that loss of near vision that you get from 40 and up, basically, but it also can fix any scripts. So it's a double whammy. So you can fix your short-sightedness or your long-sightedness, but we can also fix the fact that you need glasses now for reading. But it's still a LASIK procedure. At this stage, we don't have PRESBYOND in the Smile Pro platform yet. I believe that that might be coming in a few years, but it's not here yet. So it's still a LASIK procedure, but it's a specific Zeiss platform that we use. But it's actually a lot of what I'm saying today is very relevant for even those presbyopic patients who are undergoing LASIK for specifically presbyopia.